Hello, Dr. Davis. This is Peng. This is my oral case presentation. I have a 69-year-old male who was brought in by EMS after a fall accident. He was riding a bicycle 3 hours ago and tripped over. He said he fell on his left side of his head on a sidewalk. He denies any loss of consciousness. However, he does have severe pain to the left ribs. The patient's medical history, including hypertension and opioid use disorders 10 years ago. The only medications he's currently taking is buprenorphine daily, and he denies any usage of opioid in the past 10 years. The patient does not have any significant of family history, social history, or surgical history. During the assessment, the patient was alert and able to tell me his name and date of birth. There's no obvious swelling or bruising on left side of his head. His chest movement has equal rise and falls during the breathing, and his lung sound was clear to auscultate on both sides. The patient's heart rate is 120, but his heart rhythm was normal. His other vital signs are within normal limits. The patient's abdomen was soft and non-tender, and he did not complain any pain with palpation. The patient is currently holding a pillow for the severe pain to the left ribs. He rated 9 out of 10 for the pain. He is PERLA, and other review of system was normal. Patient's X-ray result confirmed that he has a fracture to the left 7th, 8th, and 9th ribs on the posterior side. His CT and MRI result was normal. So my assessment for this patient is he has a fracture ribs to the on left side without hemothorax or pneumothorax. So the plan for him is first to provide adequate pain control. The patient was really hesitated to take morphine when we initially offered to him. However, we switched it to ibuprofen later, but I did make sure to communicate with the patient that ibuprofen may not be strong enough for controlling his pain, and we discussed the possibility of using opioid for better pain control. Some other alternative pain management I could have offered to him is maybe using a cold pack or topical pain cream. We did put in a oral consult to evaluate possible surgery. We started him on oxygen therapy because he was having some mild respiratory, mild shortness of breath during the interview. The patient will be admitted to ICU for continuous observation and maybe some further imaging. This concludes my presentation. Thank you.